This is tuberculosis. We treat it like a disease of the past. In 2023, it killed about 1.25 million people, more than any other single infection on Earth, nearly twice as many as HIV and AIDS. 10.8 million people fell ill with it, and we have had a cure since the 1940s. Here it is across 100 years, a steady decline, and it was already collapsing long before the cure arrived. So before we dive deeper into why, take a guess. What kept the mortality rate of tuberculosis falling? Most people assume technological and medical advancement. Better drugs, better vaccines, better hospitals. Take England and Wales, where the records run longest. By the time streptomycin, the first real cure, arrived in the late 1940s, tuberculosis deaths had already fallen by around 90% from their 19th century peak. The trial that proved the drug even worked, the Medical Research Council trial, was only published in 1948, long after the worst of the dying was already over. One estimate puts the entire contribution of antibiotics and vaccines at about 3% of the whole decline. Now look closer at the graph. The fall isn't gradual, it spikes. Twice the line jumps back up, once from 1914 to 18, the First World War, and again from 1939 to 45, the second. Two stretches with some of the worst living conditions of the century, hunger, overcrowding, upheaval, and tuberculosis came surging back. It falls when life improves and rises when it decays. The cure only finished a job that living conditions had already almost done. So when it comes to tuberculosis, medicine plays a surprisingly small part. What matters far more are the conditions you live in. We call them the social determinants of health, and today they are understood to underlie most of the differences in health between populations. A German doctor, Rudolf Virchow, reached the same conclusion in 1848. Sent to explain a deadly typhus epidemic in Upper Silesia, he found it was so lethal not because of the microbe, but because of poverty. He wrote, "Medicine is a social science, and politics is nothing but medicine at a larger scale." And this is as true today as it was then. In 2008, the World Health Organization's Commission on Social Determinants of Health looked at Glasgow. A boy born in Calton could expect to live to 54. A boy in Lenzie, 12 kilometers up the road, to 82. A 28-year gap in one city under one health service. And the same pattern turns up everywhere it is measured. The better your conditions, the longer and healthier your life. So why do we still pour almost everything into drugs and hospitals? Because it works, and because you can see it work. A doctor treats the infection in front of them, and the patient improves, measurably. The conditions that caused it are slow, messy, and sit outside the clinic walls. So medicine treats what it can see and reach, the symptom at the end of the chain. So which conditions and how do they fit together? These are what we call the social determinants of health. And in 1991, two researchers, Dahlgren and Whitehead, drew the first map of them. Picture your health at the center of a set of rings, from what is closest to your body out to the forces furthest from your control. At the very center are the things entirely outside our control: your age, your sex, your genes. You're born with them and cannot change them. The model calls these constitutional factors, and notice it's the smallest layer. The next layer out is your individual lifestyle, whether you smoke, what you drink, what you eat. This is what health campaigns aim at, and the part we're quickest to call a personal choice. Worth holding up to the light, because it's the assumption the rest of this map quietly takes apart. Then, your social and community networks, family, friends, neighbors. Not to be underestimated, especially in an age of loneliness. Next, your living and working conditions, your housing, your job, or the lack of one, clean water, schooling, whether you can reach a doctor, the food you can afford. This is where most of the gap in who gets sick is actually made. And around all of it, the outer layer, the general socioeconomic, cultural, and environmental conditions. The economy, the laws, the welfare system, the climate.
the water everyone swims in without noticing.
Here is the part that actually matters. The layers are not independent. Each outer layer sets the limits of the ones inside it. Your lifestyle choices only exist inside the options your conditions allow. And most of those conditions, your housing, your money, your neighborhood, are simply the world you were born into. Not chosen, not earned. Tell a nurse on 2 night shifts with the nearest supermarket 40 minutes away and no car to simply cook fresh and exercise more, and you are asking her to beat her own timetable and her own wages with willpower. But look at the edge of the map. It was drawn in Europe in 1991. There is no layer for colonialism, no layer for global power, no layer for who set these conditions in the first place. The most important band is the one the model never drew, and health is decided upstream of it, out where the conditions themselves are written. So the model is really a question about where to aim, and it is one of the hardest calls in all of health. Where would you put the next euro? On the pill in front of you that saves this one person today, or on the conditions, the housing, the wages, the food that might save 100 people you will never meet years from now if the politics even allow it? One is certain, visible, and small. The other is uncertain, invisible, and vast. Most health money chases the certain and the visible. Most of the harm is done where it doesn't look. Medicine has come an extraordinary way, and still, almost everyone tuberculosis kills today is poor. Not for lack of a cure, we have had that for lifetimes, but for lack of the conditions that keep people well. Clean air, enough food, a doctor within reach. It is the Glasgow Gap again, stretched across the whole world. So the questions worth asking are these. Which conditions let people live well, and which are imposed on those who carry the most illness? Where those conditions came from, and who they were built to serve, and what it would actually take to change them.